Hi there, my name's Dionne. I'm a fifth year medical student at Edinburgh Uni, and I am currently doing psychiatric placement at the moment, which I'm really enjoying. Yeah, it's been a really good experience so far, and it's something that I'll consider, I think, as a career. At the moment, my key things that I'm working on are just trying my best to improve my communication skills with patients. Um, because as a junior doctor, that's one of the main things that you are doing. Um, so working on that as well as other practical skills that I'll be doing on the boards, because the best way to improve is just by practicing those skills. So taking bloods and various things like that. Um, and obviously just trying to keep all my knowledge fresh and up to date as well. So I've been trying to improve my communication skills various different ways. So one of the ways is just getting out there on the wards and during clinics and just talking to patients as much as I can, taking their histories and um, especially on the block that I'm on, psychiatry at the moment, I get the chance to sit a lot longer with patients and establish a good rapport um, in order to take a really good psychiatric history. So that's been really key. Also, just trying to ask sort of more difficult questions as well, trying to get out my comfort zone. It's just really important to sort of make sure everything's covered. So that's one way that I've been trying to develop my communication skills. As well as that, I also recently undertook the Oxford Medical Advanced Patient Communications course, which has really helped as well in my communication skills. And I really enjoyed that, and I feel that I learned a lot from that course. So the course was an online course that you work through at your own pace, which was really helpful, obviously being a busy medical student. And the way it's structured is that there's different sort of modules of the course, and there's a mixture of videos with patients and things, and actors, and there's also sort of text following the videos corresponding to what you've watched. And then there's exercises that you complete and sort of reflections on each thing that you've seen. And you work through and then you complete a sort of final reflective piece at the end based on everything that you've seen throughout the course. Um, and it was just generally really helpful to work through that. Sort of the structure was really easy to follow. And I liked how there was a lot of reflection as part of it as well, and really made me think about each situation and what I'd learned from it. And like, because it's at your own pace as well, just being a busy med student, it really helped me just not having too much pressure to go through everything all at once. Could just take it step by step. So I really appreciated that. Overall, I think I've gained a better understanding of good communication and how to effectively communicate with patients through a range of different circumstances, whether they are sort of good and quite a normal sort of interaction, or on the other hand, sometimes the situations that are seen as more quote unquote difficult scenarios, and just how to navigate them effectively. It's given me a good toolkit to work through why things are might be difficult for patients, and trying to actually understand them so we align more with patients and get to a shared sort of goal together as a patient and a doctor. And I think just trying to reframe my mindset, the course has done a really good job at sort of teaching me to view things as more helpful and rather than good or bad interactions. I think that's one of the key things that I've taken from it. Um, But as well as that, just increasing my confidence in sort of the way that I deal with patient encounters. Um, and what we've all, also just touching on various techniques and things that I've been taught a little bit in medical school, but went into more depth on this course. So that was a good revision for me as well. So I've just started this block on psychiatry, so I've still got a good few more weeks here. Um, and like I say, I'm going to be working on my communication a lot while on this block and applying a lot of the things that I learned while on the online course to this block. I think it's very relevant to what I'm doing just now. So that's what I'll be doing for the next few weeks. After that, I'll be moving on to another block on orthopedics and renal. So that'll be interesting and a bit of a mix of things and very different to psychiatry again. Um, and then I've got more OSCEs and final exams, and then it's summer, and that'll be nice as well. So that's sort of the way that it's going for me.